So we're going to talk about trigger fingers today. So Dr. Dovan, what's a trigger finger?
So trigger finger is when the tendons will get stuck in the palm, and the most common complaint is my fingers locking or snapping. As you know, a lot of pain too. And it's but really the problem is right here in the palm, and if it's the thumb, it's right about here. So wouldn't you agree we see quite a few trigger fingers?
Yeah, certainly. It's one of the most common things we see, and even with clicking and popping, a lot of times it presents early as just pain right here in the palm, just on the hand side of where the finger starts, and typically worse in the mornings, causes a stiff feeling in the fingers. But the classic is that locking down or catching down to where it pops out. And so, one of the things we always get questions about is what causes a trigger finger. So what types of things do you say cause a trigger finger when you're asked?
Yeah, great question. But to dovetail on what you just said, that's a great point on, the trigger fingers do come all sizes.
Mm-hmm.
Some are pure locking, very easy to diagnose, and some are just a stiff finger with a very painful palm. So that's a great point. So I think the most common cause of trigger finger is life. It occurs with time, it's acquired, and that's probably the most common things we see. It's not necessarily more related to the heavy activities. We see it in sedentary people, and we see it in very active people. Do you think anything different?
That's exactly right. And I tell most people, the majority of trigger fingers we see is idiopathic, which just means we don't know there's a specific cause. Now, there's some correlations that people have with trigger fingers and some things that put you at increased risk for trigger fingers. So what types of things do you talk to people about with?
Yeah, we talk diabetes is probably the number one. So and that actually helps sometimes when you have a patient come in with what we call an atypical trigger finger. If there are some underlying causative relationships, then that can help support the diagnosis.
Yeah. And also, that's right, diabetes, rheumatoid arthritis, but also, having things like carpal tunnel can predispose you to have a trigger finger. So we know there's an association between carpal tunnel and trigger finger, where if you have carpal tunnel, you're more common to get a trigger finger and vice versa. So it helps that two of the most common problems we see are oftentimes affiliated. So when people come into you with a trigger finger, doc, my hand's hurting, it locks in the morning, what are you gonna do about it?
So I think the most common things we'll do for that, and it depends on the duration. If it's a relatively short duration, if you're talking weeks to months, we'll talk about steroid injections. But also it's how symptomatic, because some people come in and say, hey, it locks, it doesn't hurt. This doesn't bother me, I just want to let you know. And those you can watch those. I think when it becomes painful and functionally limiting, I think we talk about steroid injections and then even surgery.
Mm-hmm. Yeah, that's right. And so I tell them the same thing. I say we can watch them. Sometimes people say, if you watch it, are there any long-term complications? It's not going to lead to arthritis. The one thing that we do see, if you don't have a trigger finger treated, is sometimes it can cause the fixed contracture, which means you try to straighten your finger out and it can't straighten out all the way. But that's usually months to years until that starts to occur. And so tell me about steroid injections for trigger fingers. What type of counseling do you give patients? And
so I tell them the steroid injection can be very successful. In fact, it can cure what we would cure some patients where the symptoms do not come back. And that's probably more related to the duration of the symptoms. And so I say, listen, if we want to try this, we'll try this. I typically will try one, and if that provides a temporary relief and it comes back, we'll talk more of surgery, but there's always options for more steroid injections. What's your thoughts on your steroid injection limit? That's a good question we get a lot.
Yeah, I tell patients the same thing. Unlike a lot of the injections we give for arthritis, this has a potential to cure. So one of the mainstays in treatments for trigger fingers is injections. And I will tell patients that just like anything else, the more steroid injections you put into tissues, it starts to weaken it. I certainly think one steroid injection is very safe. I think two steroid injections is safe as well. After about 3 or so, I'll start to tell them that there is increased risk, probably in theory, although we don't see it that often, of rupturing tendons and rupturing pulleys and having some of the soft tissues break down. So I usually say about 3, and then we're kind of talking more about surgical treatment. How about you?
I agree, and we talk about that all the time, and I tell them, yes, there's an increased risk of rupturing your tendon, and we don't see it a lot. We inject a lot of fingers, but it can happen. And then we go to but on the more realistic standpoint, if I give you another one, this is most likely coming back. So it's probably more practical to do the surgery at that standpoint.
Yeah.
But it's interesting on the carpal tunnel trigger finger association. You know, my thought on that is maybe one doesn't cause the other, but the thought on trigger fingers, you have a pulley in the palm. We call them pulleys. And there's the first one's in the palm, and they go into the fingers. And that first one in the palm gets thicker, narrows the canal size of the tunnel, and that squeezes the tendon. And then the tendon may get some what we call hypertrophic changes after that. But carpal tunnel is the same thing. The transverse carpal ligament, which is the roof of the carpal tunnel, gets thicker, that narrows the canal, as you know, and then you have carpal tunnel. So I think your point is great, because if we start seeing patients, well, I've had carpal tunnel in the past, and you know, if it's one of those, well, is this a trigger finger? Then you kind of think, well, it probably is. So it's a great point.
Yeah, that's right. And so just talking about the pathoanatomy or what happens in a trigger finger, why does my finger lock? The problem is, like Dr. Dovan was talking about, you get an increase in the lining on the tendon, what we call tenosynovitis. So basically there's an outer layer of the tendon that gets inflamed, and both that occurs and the tendon sheath, or the tunnel it goes through, narrows a little bit, and rather than that tendon gliding smoothly, it tends to get caught and either click or lock down. Do you have anything to add about?
No, I think that's exactly it. I do have a question for you. The question most people would ask is, how long is it going to take me to get over my surgery? What's your thoughts on that?
So trigger finger surgery is a really straightforward operation technically, meaning it doesn't take a long time to perform the procedure. But unlike some other procedures, you can see a little bit of stiffness for more than a few weeks in trigger finger. So most people we let move right away. We start in therapy in 2 to 3 days, and then they're off to the races. You're doing things you want. You're waiting on the cut to heal, but you can see some persistent stiffness and swelling in trigger finger that sometimes lasts even months and out to a year.
I totally agree. I kind of say most people will get recovered fairly early in weeks, and then there's a smaller percentage that may take months for the scar pain to go away. So we've cured the trigger finger, but you may have some symptoms of scar and stiffness after that, but it does go away.
Mm-hmm. And I say the same thing 100% of the time. Our confidence is that stiffness and pain will go away, but unlike a lot of other procedures, it does sometimes persist for months.